heard from my colleagues earlier on the pages. Lots and lots going on in the country, in the political space, in governance, in health, well, it's a lot. But then we have to take it one day at a time and take it one at a time, all right? So we don't overwhelm ourselves. So welcome to Spotlights, the 5th of December, 2024. I've been saying out the dates because, I'm just trying to remind us that it's just 20 days left to Christmas. As for some, it doesn't feel like it actually, but then what can we say? So, Spotlight is a current affairs program that dissects the top trending stories of the day the audience can relate with, from politics, governance, education, health, business. Today, we're going to be evaluating Nigeria's roadmap to malaria eradication. Very recently as yesterday, a few days ago, the health minister came out, the coordinating minister for health and social welfare, Professor Mohammed Ali Pate, at an inaugural meeting of the advisory on malaria elimination in Nigeria held in Abuja, described malaria as not just an economic and not just a health crisis, but an economic and developmental emergency that must be eliminated. And now he came out to renew the vow by the federal government to eliminate malaria by 2030. That's just 5 years away, following a loss of $1.1 billion annually to this particular illness. And so like I said, trends in the health sector, he has also come out to lament the issue of poor funding, that it has had a negative impact on the performance of the Nigeria's health sector, preventing it from meeting certain goals that are set. All right. So he said that one, I think on Wednesday at a meeting at Abuja with a meeting with the Nigerian Medical Association's third National Health Summit. And Pate is canvassing for funding in the health sector. And so those are the two things that the minister have spoken about the past few days. First of all, Egypt has recently been certified malaria free by the World Health Organization. And I think there are some other countries, our analysts will go over that. And so now the big question is, do you foresee Nigeria eradicating malaria by 2030? And if you do foresee, what are your reasons? If you don't foresee, what also are your reasons? And it's important. Let's not just take malaria like headache. It still kills people. Like the health minister said, we still lose $1.1 billion every year to malaria. So that's how serious it is. Countries are moving to eradicate it. Like I said, Egypt and a North African country has already eradicated malaria. So it's serious. We shouldn't just, you kill the mosquito and then you go back to sleep and say, oh, fine, you don't bother about the malaria. So it's still very serious. All right. So our guest this morning is Ayuba Martin. He is a registered nurse. And we'll go over this one together, analyze the issues in the health sector that the health minister has brought up again. The issues have been there, obviously. But so important to note before we talk about the guests that the Muhammad Buhari administration had developed a malaria strategic plan for 2021 to 25. That's next year. The current strategic plan aimed to lower malaria deaths to not less than 50 per 1,000 beds and achieve a parasite prevalence of less than 10% by next year. So now to reaffirm the commitment, I think he inaugurated the Nigeria End Malaria Council in 2022 to reaffirm the commitments. It also established a national malaria elimination program to achieve the eradication goal in the next 5 years. Would say because 2024 is already ended in about 2 weeks. So now we're counting 5 years. All right. Enough said. Welcome, Martin. Good to have you.
Hi. Thanks for having me on the show once again.
Yes.
Been a while.
Yeah, okay. Been a while. Well, so you're not new to the house, right?
No, I'm not.
Okay. So now you're going to, give justice to this very important one. Because I don't like the idea that we're just getting used to killing mosquitoes and then accepting it as a way of life. You know,
Yeah.
we can't just be fine with malaria. You spend money to treat malaria, and countries are looking to eradicate this illness at this point. So Nigeria, the government, a lot of money is also put in that project. So it's something that we should look into as well. Health experts have talked on it. So now let's start from how can you provide an overview of Nigeria's current malaria burden and the importance of the eradication efforts by the federal government.
Okay. Thank you very much.
Ah.
So Nigeria today, the malaria
Interesting.
situation in Nigeria, it is sad that we are still having to battle this despite all the advocacy programs, all the interventions, and all that is going on. I think people still don't seem to understand the severity of malaria as a disease condition, right? So just to give just a brief overview of what malaria is. Okay, malaria is in itself a disease, a life-threatening disease that's caused by the Plasmodium parasites. Okay, that's
Yeah.
transmitted to people through the bites of infected female mosquitoes. That's the Anopheles mosquitoes. Okay, now while it is deadly, let us know that it is curable, it is manageable. Okay, but then it can degenerate if not properly managed to severe conditions that can be life-threatening. Okay, it can lead to organ failures, organ dysfunctions, kidney failures, like hypoglycemia, low blood sugar levels, and other severe conditions, even anemia, right? I remember there was a time I attended to a patient, and we were in a hospital where I was working a few years ago, and we were, we had treated for malaria and other disease conditions, and we were still wondering why the person was still unconscious. It wasn't
Wow.
until much later, that's after further investigation. Normally after treating for malaria, in your mind, that you've managed it and you move on to the next, hoping for recovery. And it was after much later we got to discover that it was a severe case of malaria,
Wow.
right? And if not that we had found that out early, we would have probably lost that person, right? So malaria is still a very, very
Big
deadly
issue.
condition. It's still
Yeah.
a very serious condition that people need to take advantage of. Now, globally speaking, Nigeria stands as one of the countries with the highest incidence rates, right, of malaria, with around 27%, right, and about 31% of malaria-induced deaths.
Yeah.
Like that is
Sadly.
across the globe now, and about 55% of malaria cases occur in, that's in Nigeria. Talking about West Africa. Right. I mean, there's been intervention, there's been advocacies, there's been efforts, but I guess we need to do a little more. The situation it's getting better, but there's still more work to be done, and we need Nigerians to also join in the effort, to join in the
Okay,
fight. We can't keep taking things.
yeah,
Yeah.
so now, but if you're saying that it's getting better, is that do you think it's because of the common practice of open over-the-counter medication? Not a lot of people go to the hospital for malaria treatments anymore. It's just you just have headache and then you go to the pharmacy or chemist to buy malaria drug. That's one. Then you said female. How do you identify a female mosquito, please?
Yeah, how about rather than trying to distinguish which is male and which is female, let us avoid all of them altogether.
No, so that way you can avoid.
And yes, the issue of over the counter, just going over the counter, this self-medication is a serious, in fact, is a pandemic in of itself. People, I interact with people by virtue of my profession every now and then as a citizen of the society. I interact with people every now and then, and you hear, I'm not feeling well, I'm treating malaria. The next question I ask is, did you go for a test first? You say, no, I know the symptoms of did you go for a test first? We keep talking about, trying to set up systems and frameworks in place to combat a problem, and even the people are not really helping us here, right? Yes, sure. We know that by data that we have so far, there are slight improvements, but then, we really like to know how well what we are doing is working, or whether or not it's not working. Right, we don't really have, especially from the private sectors, we don't really have, data coming in as to, the amount of interventions that are done when it comes to malaria care. Right, how many people are actually being diagnosed of malaria? How many people are actually being treated for malaria in itself? Right, we know that yes, we are spending so much on malaria medications, malaria treatments, and all of that, but is it really working?
Mm.
right? Are people completing their treatment regimen? Are we actually breeding resistant parasites? Because
Mm.
that's in itself a problem when people don't complete their treatment,
Okay. So
right?
now, yeah.
So these are problems that we these are problems that really need to be addressed and combated. Yeah.
Yeah, okay. So, now I want to ask you, who collects this data? Is it the health insurance scheme or the hospitals? Who is saddled with the responsibility of checking this data? And how can, because now we cannot go on with the conversation of what the health minister has to say without looking at some of the major cause of what is breeding these mosquitoes. Because, for example, in Lagos, we are well aware of the waste management situation. And we hear from basic biology in school that, water, dirty water, and all that. The mosquitoes, you see plenty, thousands of them breeding on the water. So, how realistic is the federal government's goal to eradicate malaria by 2030 without um, without properly tackling waste management? Yeah, waste across the country.
Yeah, so it's good we know that waste is just one part of the problem. It's not the entirety of the problem, right? Okay, well, yes, the government has a lot of work to do when it comes to waste management across the federation. There's no disputing that, right? There is work to be done. We have had this conversation with several people. There's lots of work to be done, but